Hey, I am Dr. Matthew Kahrmann, and I am one of the OBGYNs here at St. Francis-Emory Healthcare. I work with the OB Physician Partners team, which is the downstairs group here at St. Francis. So, I'm a Georgia boy through and through. I was born in Macon, Georgia, and raised in McRae, Georgia, which is about 2 hours south of Macon. And I went to University of Georgia for my undergrad and went to Mercer University School of Medicine in Macon for the first 2 years and Columbus for the third and fourth years. So I've been able to rotate through here at St. Francis during my medical education. And I went to the Wellstar-Kennestone Regional Medical Center for my residency education in OBGYN, and now I'm here. One of the best things about OBGYN is that it's a wide array of both medical practice and surgical practice, and then also acute care. And at the same time, you're able to do all of those things, and you're able to have relationships with your patients that span for their lifetime. And that's really impactful and meaningful to me. I really enjoy every aspect of what I do. It's whenever a patient comes to me and she has a particular worry or a particular concern or something that's bothering her, and when I get to help her address that and get it to resolution, that's really meaningful to me. My specific interests are in surgery, minimally invasive surgery, including robotic surgery, because I'm able to give the best cosmetic results and the best recovery possible to our patients here. And then also in the office, I really enjoy what all we can do with birth control, because it's not just pregnancy prevention, but it's modifying cycles and changing the acne to less acne, and if there's any abnormal hair growth, we can also change that. It's much more flexible than I think a lot of people give it credit for. So I really enjoy the managing of birth control. So I really enjoy managing fibroids. They can really impact a woman's life for the negative, and if there's something that we can do to alleviate those symptoms, alleviate those bothers for her, specifically with fibroids, then I enjoy managing that. Specifically, there's new medicines out for the medical management of fibroids, which is impacting a lot of women's lives, and then also surgical management, because there's many different ways that we can manage fibroids, and we can do that in a minimally invasive way in most cases. When I see a patient for the first time, I really want to get to know her, not just in a medical sense, but also in a personal sense, because life is about more than just medical ailments or medical history. It's also about your children and your family and your social situation. And the way that we practice medicine is, I think, most successful if we take all of those things into account. So I spend a lot of time with my patients getting to know them on a personal level.